Brainspotting is a body-based trauma modality for processing trauma. Have you ever noticed when you're trying to remember something that you may look down at a specific spot on the floor as if that's necessary to even have the recall, or if a friend is telling you about a car accident and she has to describe the exact direction the car came from as if it's necessary for remembering it? This relationship between the visual field and where the brain holds memories is what Brainspotting is leaning on. When we do Brainspotting, we start off with regular talk therapy, discussing the topic that you would like to resolve. It could be childhood trauma, anything from childhood trauma to an argument with a friend. And then as you get activated, we'll be very mindful of what you're sensing in your body. You may have knots in your stomach, or a lump in your throat, or a racing heart. And that's what we stick with when we engage the visual field. It's usually with a pointer, and we move very slowly from one side to the other in your visual field. So you may notice nothing, or even maybe feeling a little bit better looking in one side of your visual field, and then not really notice anything, or may feel a little weird in the middle, and then suddenly on the other side of the visual field, there's the spot. You may feel like that's different, something's different, and it feels more activating. My stomach feels even more in knots. And that's where we stay. We process that, whether it's through talking or just hanging out in that spot with the therapist as a safe container, until it feels like we've gotten some resolution. Personally, I've been on both sides of this Brainspotting pointer, both as a therapist and as a client receiving Brainspotting, and I can attest that it is a very powerful tool for resolving issues that can sometimes elude traditional talk therapy.